Hello and welcome to our program Where God Weeps. According to available estimates, Nigeria is on the threshold of an AIDS epidemic. With over 5 million HIV-positive, Nigeria is second only to South Africa in terms of sheer numbers of people infected. According to Journalists Against AIDS in Nigeria, over 14,000 are infected every day and over 9,000 people die from AIDS every day. To tell us more, it's my privilege to welcome Msgr Obiore Ike, founder and director of the Catholic Institute for Development, Justice and Peace in Enugu, Nigeria. Msgr Ike, thank you for being with us here today.
Thank you very much.
AIDS was first recognized in 1986 in Nigeria, and yet academia and policymakers didn't recognize or didn't want to recognize AIDS. Why was this?
Just because of the history of the AIDS epidemic. There first of all appeared the so-called political AIDS, which linked the sickness with the African continent. And politicians did not feel that Africa must again be blackmailed with yet another ailment in the world. So they seemed not to want to accept that and tried to play it down and say that AIDS is a sickness and not just necessarily connected with Africa. That's one. On the other side, there has been academia who decide to play their own game of trying to say, is AIDS really a political AIDS or a medical problem, or is it a biological warfare? And there have been books flying up and down around this. But the reality is clear. AIDS is here, and AIDS is in Nigeria, and people are dying of AIDS. And there is no known medical cure, meanwhile, for people with AIDS. There is prevention, but there is no cure for people. And that is why the Catholic Church in Nigeria is very, very eager to make sure that this epidemic is stopped and not allowed to spread by the right knowledge and the right action.
Can one say that people, or there are people that still do not wish to acknowledge AIDS or the presence of AIDS, or are not aware of the illness?
Ignorance is the biggest disease. So many people do not even know about what is AIDS. When they catch AIDS, they think that they have malaria, or they think that one of the deities has infested them. In other words, the biggest problem we have with AIDS, not only in Nigeria but in many other countries, is the fact that people do not even know what is AIDS, how is it obtained, how is it transmitted, and the stories about HIV and AIDS.
AIDS has impacted Africa more than any other continent around the world. Other than the lack of resources and, as we've talked about, the lack of education, are there other traditions, African traditions, which might promote the spread of AIDS more quickly than in other continents?
I think that behind the scourge of AIDS is the phenomenon of poverty. If people are poor, they do not go to school, so they do not have access to knowledge. If people are poor, they do not have money, so they cannot buy medicine. If people are poor, there are no doctors, so they can't even have access to medical care. So it's not tradition as such, but much more of the factor of access to medicine, access to knowledge, access to care. People also live irresponsible lives elsewhere, but because of some sort of access and care and knowledge especially, they're able to prevent the phenomenon of AIDS. I think that might be more the reason why AIDS spreads more in Africa than in many other places.
We're going to take a break and we're going to watch a short video now on the story of AIDS in Nigeria.
I couldn't do anything. I couldn't do anything.
Please help us more. We want help.
How about the feeding? Are you feeding fine?
For we are not feeding fine, no. We are only managing.
Don't worry, everything will be okay. And you need to be patient. Patient and pray.
My husband just abandoned us, me and the children, and they went, I don't know where he is now, since 5 years ago now. So I only stay here with my children. They are 7 in number by the grace of God, but one has died, so remains 6. The child just developed sickness after when we went on the test. They said that it's HIV-positive. I hide it to everybody. Even my mother didn't know. Nobody knows. Because if they know now, everybody will run from you. It's only them that knows it. Even my children didn't know. Nobody knows. So I hide it to every ear. Nobody knows. Talk less of to help. Because immediately they know, they will broadcast it everywhere. And everybody will run. So I hide it. I don't let anybody to know.
In fact, if not for the Catholic Church, I don't think some people will even come out to say they are positive. Initially, I was trained as a priest, but I was not ordained. So I withdrew into public life because of the family problems that have engulfed my own house. The parents of these children you see me with, I adopted them because their parents died of HIV and AIDS. My 2 senior brothers and my younger brother, the first one has 3. The second one has 2. The third one has 3 also, making 8 of them altogether. And all of them, their father died of AIDS, their mother died of AIDS. So about 8 of them are living with me. Even these 2 I have with me, they are also infected through mother to child infection.
From our own records, about 80% it's through sexual contact with their partners, and the children we work with transmitted from their mothers.
I lack the words to express the gravity of the AIDS epidemic. Genocide, horror, tragedy. If you just visit any African hospital to see people dying in conditions that they look like they've come out of a concentration camp, it's a profound challenge to our time.
People are not very aware of the basic facts of the virus, so there is still a very high level of fear. A fear in the sense that if I sit beside somebody who is infected, maybe I'm going to get the virus as well. If I share cups or domestic utensils in the house, if I share the same toilet, the same bathroom, if I lie on the same bed, and so on. When we go out to villages to educate people, very often we find out that there are no health facilities in those areas. So we go out with medicines, and where there are sick children, maybe sick mothers and others as well, we provide a curative care. And those who are too sick for us to handle, or maybe those who are at high risk, we bring them back to Mina, where we have the health center for further care.
We call it support group meeting. It's a meeting where all those who are infected with HIV come together to discuss their common problems. This center was established about 7 years ago by the Bishop of the Diocese, Martin Uzuko. The services we give here, we create awareness, we give immunizations, we have a little theater there, and so we conduct minor surgeries.
You see people coming up here every time, in the morning, in the evening, in the night, no time. Sometimes when we are sleeping, somebody will knock on your door and because he has come to share. People confide with us because they know that we are caring for them.
I believe that 60% of the healthcare in Nigeria is private. Only 40% is state-run. We are responsible for some 320 institutions. large as well as small hospitals. In many cases, Catholic-run healthcare is located deep within primitive village areas, where government healthcare is not provided.
Our problem lies on how to get the drugs. Because we all know that concerning this sickness, it doesn't have cure. But there's some drugs to use, it at least will reduce you boost up your immunity. But here, we don't have such drugs because of lack of money.
Our people also die, maybe because they don't have that enough money to buy the normal food they should eat.
For those who are very sick with the virus, unfortunately, we don't have much to do and we are really handicapped.
So this is the brother we have come to visit, and he has undergone an operation and he's still recovering from the operation, and is one of those that we have facilitated through our work as the outpatients that we do have in the houses. He's at home because of money that he couldn't pay. That's why we have to retrieve him from the hospital to come and keep him at home.
Healthcare is expensive. Also, many hospitals lack proper drugs and the patients have to pay fees. There are few cases in which the government will provide salaries to doctors or nurses working in a missionary hospital. Very often, hospitals cannot hire doctors because there is no money to pay them. Additionally, we have a health policy stating that if a patient comes to the hospital without money, we cannot send them away. We have to treat them and pray that maybe they will pay.
The doctors who give their services, they are Catholic doctors and they do it free.
We cannot carry out this without any support from anywhere. We remain grateful to the Church in Need from Germany for the support they are giving us. The government is not helping us in any way. We have tried to contact the government several times, but it has always been promises, and these promises have never really come to reality. I remember I was involved in the year 2000 in developing the HIV/AIDS policy for the Catholic Church in Nigeria. And I remember at that time, the government didn't even have a policy yet on HIV/AIDS.
The Catholic Church is on the leading edge of treatment in Africa. They're the ones that introduced home-based care, care of AIDS orphans, and now are on the cutting edge of bringing antiretroviral treatments. And just as the Catholic Church has been a leader in treatment, it is now becoming a leader in prevention. We know what works to prevent new HIV infections, and that is abstinence before marriage and faithfulness within marriage. And that's been shown very conclusively to lower HIV prevalence in Uganda.
You saw this signboard and it said love is all about responsibility. But anyone looking at that will say, oh, this is beautiful. Yes, love indeed is all about responsibility. But what is the responsibility? It is the use of condoms. They don't talk about the side effects. And you know, for us here, it is even dangerous. Because you see, the condoms, for example, if they are distributed, sometimes one uses it about 3 times, 4 times. They don't dispose of it. And when even it is disposed of, children pick it behind a refuse dump and use them as balloon. You see, the government is at a crossroad. They have to please the international organization for them to be supported, you know, financially. And they also have to please the people in the country in a way because their culture goes contrary to what the international organizations would want the government to do. So there is a clash or there is a contradiction. On the one hand, our culture does not permit the use of condoms. It encourages and preaches chastity before marriage.
Look at the epidemic, 20 years into the distribution of condoms, and what has it brought? Nothing. it really has not changed the face of the epidemic.
There are millions of dollars used to produce condom. And here the people here are dying of poverty, dying of simple malaria that you can just take a 20 naira chloroquine and you are off it. It's not up to the costs of one condom to treat malaria in Africa. But where is the drug? Where are the funds for even people?
The evidence is on the church's side. The evidence, even evidence that has been generated at the United Nations, has shown unless there is abstinence, the word they use is delayed sexual debut, unless there is faithfulness, the word they use is partner reduction, then the new HIV infections will continue to increase. Today, there's somewhere around 14,000 new HIV infections every day. Somewhere around 9,000 people die of each day. So if we don't stop new infections, they will continue to overrun the meager healthcare resources that exist in many African countries.
I have a story. Are you ready to listen to my story? That is it. Have you the patience to listen to my story? That's another. So in most cases, it is not the sympathy we need, but it is the hearing of us and seeing, exploring ways and means of coming to our assistance.
Welcome back, ladies and gentlemen. We're here with Msgr Obiore Ike, the founder of the Catholic Institute for Development, Justice and Peace, and we're talking about the situation of AIDS in Nigeria. Msgr Ike, can you tell us what is the socio-economic impact of AIDS on a country like Nigeria?
Well, what death does is that it erodes. It erodes economic, social, cultural, political, and otherwise power, which people normally have if they have life. When people are alive, they get things done. They move a nation. When there is death and there is sickness, these things are reduced. So the impact of AIDS in Nigeria, especially, we've seen it in other countries, is the fact that there are more deaths, children are being orphaned, mothers are dying without their children, children are being infested while they are very, very young. Healthcare is very, very bad for such persons. They don't go to work, so they don't contribute to the economic development of a nation. And they spread it also, which means more mortality, especially when they don't have access and they don't have knowledge. AIDS is a scourge, and it's just is a sickness one too many, more so that there is no known curative medicine, meanwhile found by scientists to put a stop to it.
The life expectancy in Nigeria is at the moment around 45 years, and AIDS is continuing to erode this number. Do you have a concern for the future of Nigeria, particularly that 30% of AIDS victims are the young people?
There is always a concern when people die young and when life expectancies, even though debatable whether it is 46 or 70, I have people in my area who live very, very old. Actually, we must say that Africans have ancient people who live 70, 80, 90, even beyond 100 in my own village. Nonetheless, the impact of a sickness like AIDS is such that with life expectancy reduced, especially for children who are breastfeeding, who cannot reach their first birthday just because they had to die for a sickness they knew nothing about, it is critical, and we have a lot of concern. More so if this sickness continues to grow. Then you have an explosion like what we had in Uganda and in South Africa probably, of having villages that are completely decimated because there's nobody living there. Agricultural implements and farms are abandoned because people have died. We are witnessing it in some parts of Nigeria, in the Benue region especially. And one may say also that some cultural practices may do actually affect, for example, the issue of polygamy, the issue of irresponsible sexual behavior, the issue of unfaithfulness in marriage, the issues of exchanging partners, these are areas where I think, and the issue of a very horrible attitude, go to sex anyhow but just be careful of how you go to it. I mean, an attitude that makes it a free-for-all without any responsibility. Something we have to teach our children to watch, because sexuality is a gift. It's a very big gift from the Creator, but it's a gift not in the air, it's a gift in a context. It's a gift founded on love, and this love is shared.
Msgr Ike, the Catholic Church is often perceived to be ill-informed or out of touch with regard to AIDS. How do you perceive this assessment?
People will always have their say, but you know that the Catholic Church is not only a global player, but it's an ancient player, and it has a lot of wisdom and knowledge, and doesn't do propaganda for itself. I do feel that the Catholic Church knows a lot about the predicament of AIDS, because it goes to the source. Why is there HIV and AIDS? Why is it spreading? It is all the greatest cases of HIV and AIDS are found in irresponsible sexual behavior. And that's where the Catholic Church goes. But some scientists and some modern people will try to say, forget irresponsible sexual behavior. Let's talk about how to go over that and retain our attitude. I do think that the church could do more still in Nigeria if it had the means and it had the expertise, especially medical doctors, trained nurses who will be available in villages to be active in this area. For my own work in Nigeria, I run already orphanages where people affected by AIDS live. I have a strong youth movement where we do awareness, neighborhood foundation, awareness for people, especially young people, to get knowledge, full knowledge about the implications, about their actions, and about how to prevent that they do not at all get AIDS. And the answer is very, very simple. Keep yourself faithful, be faithful in marital relationships, no irresponsible sexual behavior, and follow what the church teaches. And what our tradition, of course, also teaches, because our tradition is very, very sincere. Our tradition is very, very founded on virtues and values of truthfulness and openness. I do feel that the Catholic Church in Nigeria has to do more, especially in other dioceses. Not every diocese is equally aware and has access, whether it is to medicine. We have to advocate also before pharmaceutical industries that they have to make medicine available to people. We have to advocate before our medical doctors that they have to enlighten people properly. We have to advocate also before the state, before the government, to take HIV and AIDS more serious than before, because it are citizens who are dying.
Africa has been subject to, one can say, a condomization, that is a great push to provide condoms to the young people as a response to the spread of AIDS. How do you see this? Are condoms effective, or are they not, and why not?
That's a topic that is very, very critical, and I think that we must take it very serious. More so that international organizations from America, from Europe, even from the United Nations, try to buy up African nations, African organizations, African peoples, by virtually like forcing down on them a philosophy and a practice that is contrary to our own culture. And this condomization, which I've spoken about, is something we have to take very, very seriously. It contradicts the position of the church in Nigeria and worldwide, and it does not even solve the problem. So where we must go now is to look at an attitudinal change, first of all, and living rightly, living fairly, living justly, living correctly. Friendships that are founded on values, sexuality that is responsible, parenthood that is responsible. So like the Planned Parenthood Federation of Nigeria or institutions of the United Nations, one thinks about the United Nations Population Fund, which comes with such activities and so on. We do agree that there is a problem with unplanned families. Families have to be planned. But the condomization as a method of planning families is unacceptable for so many reasons. It does not solve the problem, neither of AIDS nor even of the families, and it reduces, like the church teaches, even to some extent, the dignity of those who are involved.
Msgr Ike, thank you for having been with us here today on our program. And thank you, ladies and gentlemen, for having been with us here today in our program. And if you'd like to know more about the situation of AIDS in Nigeria, or perhaps how you can help the work of the Catholic Church in this regard, I encourage you to look at the contact information at the end of this program. And we look forward to seeing you next time on Where God Weeps.